uh, primarily the idea behind having this conversation is that we'll keep it very simple, flowing, and not have a kind of a set pattern. We'll look through different facets of your own life as a neurosurgeon, and for the interest of people who are watching us and listening, Dr. Krishna is one of the most accomplished neurosurgeons in town in Bangalore. He has several feathers to his cap, and I would actually prefer that you take over from here and kind of talk about where you started, where are you from, and uh, let's move the conversation in the direction that people who are watching us or listening to us should get an idea as to what a person can achieve in his lifetime. Second, we will also talk about different aspects that will help our listeners or audiences to kind of understand what neurosciences is, what are the different conditions, how they are treated, what could be the recovery, some tips for prevention, and certain correlations of our brain health with our general health, and so on and so forth. And I will leave it up to you to talk about yourself.
Thank you, Srivatsa. Uh, yeah, to tell you frankly, I grew up in an age when man reached the moon. Frankly speaking, I was in my high school, and my whole aim was to become a, you know, those days rocket scientist, if not a astronaut, because that was the technology that was thought about. Uh, that's something that you're doing much beyond our imagination.
So this was in the 50s, 60s.
Late 60s, as you know, I think somewhere around 69, we landed in Apollo landed in on the moon, and from the school we went to see that moon rock that was brought down in the same city, Bangalore, as kept as an exhibition. We were standing, I remember vividly, standing in the long queue to go and have a look at that small stone, like what you, as if you would be seeing a Kaaba stone.
So the actual rock from the moon
Yeah,
was displayed in
yes,
Bangalore. Oh,
yes,
wow.
yes. And like many of my friends, I thought I should also be an engineer, and then that we thought it's a gateway to heaven, that is to enter NASA. It was our ultimate aim. Destiny took me to biological sciences, entered medical school, and bit of to start with, it was Greek and Latin. Literally, in the sense that most of the medicine that were made to look difficult was because the terminologies are used are all Latin terminologies for simple things,
Mm.
you know. And then the type of education that was imparted upon us, even in the medical college, was like the rest of the biology what we were heard of. We tell this, define this, names and names and names. Many would get frustrated. If the names had a meaning, by the time you learned something, in those days the medical education was learned in a different, you a raw 17 or 18-year-old persons directly as in India we can enter the medical college for undergrad course, and you moved from almost your 12th standard school, you moved, and somebody comes and talks to you about your hand, somebody same time is talking about your heart, what we say anatomy, physiology, all disconnected. And try to, we're all used to reading from chapter 1 to chapter 10, and you finish this and you go to the next level.
Has it changed now?
Significantly. I myself have taught after getting qualified and became studied for maybe another close to about 18 years. Not 18 years, sorry, about 14 years. When I became a specialist neurosurgeon, my interest grew, and even today I'm learning and enjoying, and sometimes I realize now what are the meaning of something what I was taught on the first day of entering medical college, because now it has more relevance to me.
You mean to say the applied part of what you learned during your younger days, you weren't clear when it was told or taught, but it started getting more transparent when you grew in your practice?
Yeah, the way it was taught, the way the exams were conducted, like whole of what you have studied for a year and a half. Uh, no, those days we used to have what they used to call essay type questions.
Hmm.
The entire anatomy of the human body, which I'm still bewildered at some parts of it, and I have a relook at it if I have to operate on a, some rare corner of the brain or spinal cord. Those days they were all taught to us in a year and a half, and then you would be just asked some 6 questions to write as a theory, and you have to score 50% out of that, and then 300 marks or so, and then you a practical class examination, again you have to score 50%, and then the viva. When you go to the viva, imagine they can ask the one particular nail bed, measurement to with something in the brain, what connects to what, anything he can ask, and you are supposed to know 50%. But things have changed significantly. I myself was a teacher at the medical college till about 20 years back. In the undergraduates and postgraduates I have taught. It's for good. It made much easier. And in coming to postgraduate times, there is to be, of course, there can't be a standard textbook, but now they are made kind of. Most of the time, it is exam oriented. Our education is exam oriented. The real learning starts happening after you are licensed to practice the profession. It must be
Actually,
same with you.
absolutely. Because I think uh, there has been enough research also done on this. And I forget the name of the book. I think it's The Originals by Adam Grant. And one of the things I think that is mentioned in that book is that high performing school going kids necessarily need not be outstanding professionals, or rather, the research says that they will not be, because they are not thinking, out of the box, or they're not being who they are supposed to be or who they are. So that's a very interesting observation. I'm sure you might have been a great teacher. Another very nice aspect that you mentioned, just today I was listening to probably your colleague Dr. Ravi Nair from St. John's, formerly
Yeah.
the ENT
Yeah,
surgeon.
yeah, yeah, yeah. Yes.
And
Was my
he
colleague.
interestingly mentioned exactly what you mentioned, which is that it was a time of science and technology and engineering. And he said he never wanted to be a doctor because he was influenced by at that time with
Absolutely.
science and engineering, and he wanted to be an engineer. Uh, so that is something that is so much so common. So that's interesting to note that there are uh, segments or patterns of a entire timeline. Like today we are looking at a startup world, so probably every young person who is getting educated, whatever field it may be, commerce, medicine, engineering, or anything else, even an artist for that matter, probably is looking at entrepreneurship.
What you are looking at a young, impressionable age person in the schooling and higher schooling is what you see around. And each one of us has an aspiration. You should have that sense of feeling that I need to achieve something. It's in the good sense
Right.
and good competitiveness. And what will you try to achieve? You cannot keep on imagining the peaks. You have to see some peaks, which is appreciated. So, for a person who's going on the road, something flies high and can go beyond your vision is something fantastic. So that's how the rocket science and the famous phrase. I think it still continues in years. It's not rocket science. Come on, you know. But why did it make the name? And
Interesting.
so and later, because of that blend, as we entered, I realized, okay, you're joined. And of course, like in India, it's not so easy to leave from one course to other course, whether you like it or not. At least then, I'm talking about 50 years ago. Uh, it would not be easy. So then you go through it, the drill of it, and you're shared it. intelligence, or you develop a knack how to go through the exams, and then we try to find a path. Now, why would I choose to become a neurosurgeon? So somewhere, there is an impact that happens to you, that though you are considered then not so good performing in a class of 100 because you lost interest. There were quite a few of us who lost interest because the way the medicine was taught, the way it was dished out to us. Then you get some impactful people coming and talking to you, like we are exposed. So we saw a great man who started the Neuro Institute in Bangalore, one of those kinds, first in India, that is DIMHANS.
Okay.
Professor R.M. Verma, late Professor R.M. Verma was really, really, I can say in a way, impressed upon us. I think we were in third or fourth year of medicine. And so much, so nicely, he was talking to us those days. If I remember correctly, Roger Sperry, a Nobel laureate, who explained about the right brain function, where your music, art, and all comes, and the left brain is the calculation brain. And it was so impressive. So, and then I thought he's a neurophysiologist or somebody who knows so much about brain. What he's done, he was, we know that he was a neurosurgeon. Then we know that there is something happening. And then he made us interested. There's an unexplored area. Brain, so much of it. I'm certain you also agree with me. Even today, we
Yes.
talk about brain. I do so many surgeries, and from that time to now, the knowledge about brain and its imaging and how what can we deal with is tremendously increased. But huge part is still not known how it works,
Correct.
how I can make it to come back to work. All I know today is to preserve. In my surgery, we try to preserve what is left behind, prevent further damage. But I am still not able to know make what is not working work. If we know that, then we have the whole world in our hand, right?
Absolutely. Absolutely.
So that's how the interest grew. So there is something unknown. So if we are made up of it, I should be neurosurgeon. You know, that's appeared to us as the top of medicine. Everything else probably, and I mean, I know that so much of biochemistry which we don't know, but there is nothing like you want anatomy, this in the nervous system, most complex. You want the biochemistry, it is there. You want to know the physiology of it, it is there. And whole pathology. Coming to it, like today's talk, that what is the impact of it? If it is somebody else knows every disease we know of today, of different parts of the body, also affects the brain and the nervous system, and directly or indirectly, be it be infection, injury, birth defect, genetic defects, developmental defects, cancer, anything you think of today of any part of the body. So all pathology is affected. Every bit of chemical that we absorb in our food or we need has its direct impact on the brain and its functioning. So here was something. It is not that today I realized, I am learning more and more, but interest was created then.
Unbelievable. And I think something very profound that you brought to the forefront is uh, every subject is interesting.
Absolutely.
It's about the person who makes it important and impactful to a student.
Absolutely.
Because I think I can go back in my own life as a school going kid. I developed hate for mathematics. And the hate for mathematics, though I was good at it, I intentionally started doing bad because I didn't like the way it was taught to me. And the teachers who taught me were not pleasant. We would get hit on our knuckles for having done something wrong. And that fear, that intimidation, and the way they projected it to us, saying that you will get a punishment if you don't do this the right way. So when it came to 10th, I kind of just wanted to write the exam to pass. I didn't even waste a single minute. I attempted the exam for the passing marks. I was certain that I'm going to pass, and I walked out. And that was the last time I actually studied mathematics because I developed hatred towards it. That gave me an inclination. It's not that I always was passionate to be a doctor, but then it wasn't that I was bad at mathematics, so I chose this. But it's a person who did that. And then we had the choice to either study mathematics, biology, physics, chemistry together, or just biology, physics, and chemistry. And I opted for biology and physics and chemistry as a choice because I wanted to get rid of mathematics. So I never looked at any other stream. And that's so vital that you have to have inspirational teachers. And the
Absolutely.
same way I was inspired during my studies in my dentistry, obviously by some great people whom I got to meet within India and abroad, because I also faced this resistance when I was a student of dentistry. Most people would think, where did this guy disappear from college? My attendance was pretty low because it was kind of, if you ask a question, your teachers would say, this is not the time that you can ask this question. You will be taught this in your final year. You go to final year and ask that question and say,
Should
did
all.
you not learn in the first year?
Yeah, absolutely.
Right? And
Yeah.
questioning was seen as arrogance. So, as a dental student, I thought we're going to work on teeth and mouth. When I went for some of the practical lessons, we were being given plaster of Paris and made to make cubes of 1 inch out of plaster. I was wondering, where is this relevant to dentistry? Asking that question, you were thrown out of your classrooms, right? And so that created fear and that created a disconnect. So,
Absolutely.
what the good part is that I was focused. I said, look, I will seek the answer. So, what I would do is kind of leave Mysore, come to Bangalore. I'd organize somebody who had a. My father had told me that there's something called British Library, and there you will get the list of all the universities and so many good things.
In St. Mark's Road
Exactly.
Junction.
Exactly. So I had a friend's friend who had a
Okay.
membership, and I would wait there. And at that point in time, we didn't have mobile phones, nothing at all. So it was like every week at this time, at this date, I'll be waiting there, and they would give me access. I had only 1 hour because that's the only time they would leave. And we didn't have photocopying, phones to capture pictures, nothing. On pieces of paper, I would write down all the universities. And it was expensive to write air mails at that time, right?
Absolutely.
And I would write my questions to professors in Melbourne University, in Sweden and US and things like that. And it would take about a couple of months for them to reply back to me. But they replied back. And that to me was so, so, so great. And not just replying back to my questions, because I would ask them, why is external carotid artery important for me? And they would explain to me the importance and the applied part of that anatomy, though it was there in our textbooks, but nobody bothered about it.
Absolutely.
And the last sentence they wrote to me was, please feel free to contact me again if you have any further questions, in a beautiful sealed envelope. Every time, everybody replied. And that was inspirational to me. And that is how I got molded. And that is what was my inkling. So, this is fantastic. So, most people get discouraged thinking that I got a bad experience. It's not that the subject is bad, it's just that one person who is teaching you that may also not know. It's not worth debating or discussing why was he like that, because a lot of us don't have that introspection, right? That's a beautiful thing that I think that we should develop passion to go behind
Yeah.
seeking that knowledge.
Yeah, you put it exactly. Those, I always believed. I mean, this was the same feeling I had when I was an undergrad student in medicine. And I decided, I said, we had excellent doctors, very good professional, who are not so good teachers. Then you had very good person with well informed, maybe he had answers for everything, but neither was a good professional doctor nor a good teacher. To have a combination of in a professional course, a knowledgeable person and an empathetic clinician and a good teacher is extremely rare combination.
Mm.
And frankly speaking, I try to, you know, imbibe these three qualities throughout. So that's where we meet. I think no, both of us have the similar aspirations. So wherever I go, if you see something, you try to analyze. If you know something, ask them not in the intent that question them or
Question.
anything. If they can
Curiosity.
be, yeah, ask them if they know, and if they don't know, explain. And I have done that in this my practice in this city for last close to 38 years. When I was asked to visit some patients in nursing homes, then I'll catch an youngster. You know, today you have so many neurosurgeons. We were only three outside NIMHANS
Hmm.
in the city of Bangalore. Of course, the population has grown, and so are the numbers. We are 170 plus today
Just in
neurosurgeons just in Bangalore. So, so many institutes. So, what is to how to draw attention? My primary intention was not to show that I know better, but for my patient. So you got to ask them limited knowledge. Today somebody has a clot, somebody will call and show me the head injury, small clot. So I will ask them, how do you know where it is, how to do it. We all stand like this, scared. Oh, this man comes crazy, he's asking. No, look here. You know how I would go, suppose this is your kith and kin. What are you going to do? Am I going to operate him? Not going to operate. What are you going to observe? Like that. In every place. Today I'm happy wherever I go around. A lot of people identify me. It's not that I want some very popular person or anything. Oh, sir, we used to remember you. You are coming there. You've seen one of these person, one of these patient. Have I done something? I feel really satisfied. And I think that should be the aim of many of us. There may be better doctors than me, more knowledgeable, more skilled, but are you, the word you use, impactful? That's what Professor Verma was to us. And we had a couple of more people who they used to call, through IMA, one of our teachers. He didn't teach us much. I don't think in my own assessment those days he was any great doctor, but he did good thing as a teacher. He would bring in through Indian Medical Association chapter, was secretary or something, those days back in Mysore. He would get these people, how difficult it was. Finances were difficult, they were from outstation. So if they were coming by, he would somehow gather information, call them and make them give us lecture out of the syllabus. That's what stimulated us. That's what made a few of us go after it. And to tell you frankly, many of my undergrad classmates, uh, much later, maybe after we left medical school 10, 15 years later, they suddenly meet, hey, we can't believe you, man. You're a neurosurgeon. We thought that this guy is not interested in medicine and you're doing one of the finest surgeries. How can you do it? Like as you said that most of the time I would also go away from the class. Attendance was always a problem because there's not at all interesting.
right.
Somebody would come and turn the pages and keep, reading out.
It'll actually be very interesting because I am also out of the academic circuit for the last few years because I got disappointed with the lack of attention to detail and actually grooming great doctors. That's what medical schools and dental schools should do. I'm still passionate, but I think there are hardly any opportunities left. But having said this, we had no choice. Though I'm way junior to you in terms of the experience and things like that, we had no choice but to go to class to listen because we had no other source. What do you think is the changing trend? Because today, whatever is going to be taught to you as a theory lecture in your class is available online for you. There are YouTube, there is so many other online learning platforms. So, where do you think this has probably changed from a student teacher interaction and a student respecting a teacher for the value that he's adding? Because at least we had to listen to them because that was the only source for us to learn. But today you can learn from different sources. And I think, does that not add a greater responsibility on the teacher to make their students listen to them with greater attention because they have to create that much more impact?
Yeah, it has got several aspects to it, I mean, in nutshell, if you are asking how um, good a teaching medical institute, including the faculty, has to be. But I think it is both ways. If I look at the percentage of people who went because they wanted to be doctors, if I am taking the course of medical course, was passionate to be a doctor, again there are different reasons to become. We say passion, oh, I want to treat somebody, or I want to be respected. Everybody says you're a doctor in a crowd. You're introduced. Generally, people are not introduced by their profession.
Hmm.
Only that a doctor always knows doctor so and so. For many people, it matters. I'll be recognized. Then somebody sees it as a profession where you can earn a lot of money. Empathetically, I want to do something. Really, there are sick people. I don't know really what percentage of students are coming with that idea out of interest, out of curiosity, or okay, I want to help somebody. Because there are many ways of doing that. So that category percentage wise probably remains same as far as student is concerned. Now
So are you
come.
saying that there are equal number of students joining medicine out of passion and the willingness to help the community?
Yeah, I don't think it has changed.
Changed.
Percentage, if I take 100 students, then other things, sometimes it adds on.
But
Then,
that's one pool, Chief, of joining. But is the current medical practice, quote unquote, ecosystem allowing that passion to sustain when they come out of medical schools?
yeah, that's what I'm coming to. Now, methodology of learning, availability of the information in terms of library. I think you also belong to a generation where we had to go to index medicus to look for
Yeah.
cross references. So
Yes.
my entire postgraduate training, at least in general surgery, we had some so-called textbooks. There was nothing like that when we did neurosurgery. We had to go out for journal articles, add some monograms to look at, and then make your own notes and combine, give our seminars. The seminars were to an extent that after my first year, because I was the first batch in the institute, my professor asked me to make a list of seminar subjects.
Mm.
For the rest of the 4 years I spent in the institute, I was making as a student. I had the choice what to pick up for myself, but we didn't do so. So that is because I already had developed an interest. I wanted to be the best person to come out. Because another teacher, if I remember today, um, Dr. Vidyasagar, who's no more in India, he is moved off to Australia. He was then a neurosurgeon at St. John's. I was in general surgery. I said, I'm going to take up neurosurgery. He told me, let's say, I've done all kinds of randy things, but when you come out, you don't move away. Maximum, you don't look at your hours of work. You look at that you have been given an opportunity to learn at, without so much responsibility. So be there, whether it is your patient or your colleague's patient. If there is a problem, attend to it. You are learning. That stuck in my mind. It really worked. It really worked. Even today, when I go back to the institute for various alumni meeting, my teachers who also come. Most of them were retired when I myself are retireable age from the teaching as a teaching faculty. They still remember how we spent, and that has carried me on because imagine you would be seeing 1,000 surgeries in a year.
Wow.
1,000 surgeries in a year. 4 years you spend 4,000 surgeries, 4,000 complicated brain surgeries. I'm pretty much certain in private practice, if you have to learn that, you will have to spend almost 2 decades. So you are learning.
I think
So
that
that was what was told to me. That part is very important. But the information is available today. I've seen my own younger nephews, uh, you know, who's now finishing with medicine. The pattern of teaching is different. I took his books. He said, Yeah, he tells me, uncle, I have these books. I say, what are you studying? I like to do this book. That's made simple. And he's passionate, I've seen. I don't know how many of them because I was also an undergrad student, I mean, teacher. I used to see the same category. But they're more informed because information access is very easy.
Mm.
The teacher can't hold it and come and if as you did with difficulty get the information from across, easily available to them. And today with electronic media, you don't have to
Technology.
carry big fat books.
Exactly.
And there have been more education material available, pocket books are available, quick reference is available for an interested student. So somebody coming back to the teacher, one way, there is a difference in many uh, private medical colleges in this country, wherein performance of the student is directly reflected on the teacher. Teacher is assessed, the management is after you.
That's very interesting to
So
know.
that makes the teacher also, you know,
Accountable.
accountable. He may not be a great clinician or a great doctor, but definitely he has to be, and an average. Uh,
In fact, that's a very valid point, and I didn't know that in India we had a system like this. But when I was a faculty and leading a department out of India, we had a protocol of assessing every single interaction of a student and a teacher, and the teacher's assessment the students would give. So there was a physical
yeah,
form after every lecture that students would fill as a feedback, and then the coordinators of the programs would go through them every single time and give a reverse feedback to the teacher saying, probably this is where you have to modulate and things like that. I'm very impressed to know that even in India something like this exists. Coming to this aspect of availability of information, like I still remember when I studied, forget about you, I was told that there is no standard book for any subject. There are many books,
yeah,
and you're supposed to explore. And that exploration was like most of these books are authored by international authors, and we had no access to it. And to buy them were expensive, but still, like you said, the interest or the inclination or passion to go behind it. We used to borrow books, photocopy them, things like that. But now I am wondering if people are really accessing that, because from a very psychological perspective, if you feel just like the phone numbers, probably during your times and my times when there were no mobile phones, we would at least remember some 20 to 30 numbers which are important, phone numbers.
absolutely.
But today we assume that it's on our phones and we don't even know the phone numbers of our own family members or even first circle family members. So I feel somewhere even our student community may have slipped into this attitude that, oh, anyway, online I'll get this. But are they accessing is a big question in my head, because when I interact with some students, I see that though they have come out from reputed schools, they still are lacking basics. And that's purely not the responsibility of the teacher. Yes, it is, but I won't still blame the teachers completely, because the access to information is available and these people haven't done that basic effort.
There are some clinicals, there are some experimentation done on that basis, like uh, problem learning, like
Problem based learning.
problem based learning. So the day were taught when I was in the faculty at Ramaya way back, I'm talking about 20-25 years back itself. They were given on a given day a topic and then go backwards. Cough, somebody comes and what are the organs involved in putting it out, irritation. Now you go to anatomy, physiology. The post expulsion is what is cough is. From there it would start on. But again, what I see is that's good, and in fact, a lot of Chinese to prepare overnight doctors. They try this methodology. Malaysian government used to take. So there is a separate wing there, if I am correct, in MS Ramaya Medical College. They train the Malaysian students here, they
Oh,
go back and take the exam there. All these are being tried. Ultimately, what I feel is, you know it today, it's such a vast thing, the medicine. We have the habit that, they compare themselves with many other graduations. Its medicine has to be ultimately learned through apprenticeship. One can only guide you. So, moment you get a degree, you are supposed to understand that you are licensed to learn more and practice under somebody's apprenticeship.
you have to stay invested.
Yes, and the structure also has to be like that. At one end, the government says, I want a doctor everywhere. You can as well as trained nurses are there who could do. If you look at just MBBS doctor, on the day one, if he comes as an intern, he is much below a nurse, diploma nurse who has worked for 3 years, because she can handle a patient much, much better than this doctor,
Interesting.
because she has the clinical all from the day one. She's all the time with the thing, and then she goes back. She works here, goes back and takes the thing. That is how the quality. In fact, even as surgery, many times we were taking from the senior scrub nurses the tips to handle the instrument or a situation. But today that has also changed from good to bad, I must say.
Also, I think that brings it to a very important observation, which is today even doctors are job hopping, right? Uh, and somewhere I'm seeing dilution of quote unquote the word guru or a mentor. Even during my generation, I think we were influenced by certain people, and then we stuck on to a few pioneers and worked under them for a length of time, right, to actually gain. It's almost like a gurukul system, and I somehow feel that medicine has the best effect when you practice under a certain person for a certain length of time, because it's not about knowing a condition that you can know in theory, but about variabilities in that conditions, because you're treating different human beings with different psychological uh, you know conditions, who have different sets of fears, who have different sets of question, and to overall gain an average understanding about it takes time. So for those who get into this field, I think the entry criteria should be uh, the question they should ask themselves is, are you willing to spend time to go through this? I'm certain, for people who don't know, neurosurgery is post MBBS. That's like 5.5 years plus another 2 3 years of your post graduation in your master's in surgery, and then another 3 to 5 years as a neurosurgeon, or the MCH in neurosurgery. Am I right? Is
Yeah,
that the
yeah.
length of time? And not to fill in the gaps that it takes to get into an MBBS seat, and then the gap to get into MS, and the gap to get into MCH of neurosurgery. And then you actually start learning. And from there, it's a clear 10 years that you have to be with someone constantly to understand. And this job hopping scenario that has started, I feel most of us are becoming like Abhimanyus, learning something somewhere and thinking I know the entire thing and just going. And and will this affect the overall outcomes on patients whom we are treating?
Yes, certainly. See, if you're looking at from the point of uh, ultimately what the medical profession does, it is meant for the care of the patient. Easy getting the best. In a way, first we didn't have numbers. They had to wait in long queues. As I said myself, 38 years ago, there was only one institute outside Nimhans, that was St. John's in this city. And if I remember correctly, there was only one more place in the state of Karnataka, that was Manipal, where neurosurgery was there.
Hmm.
So it means NIMHAS, the central uh, government institute, St. John's Medical College where I was working, and at Manipal for the entire state. From that, now availability are there in plenty. So certain emergencies which can be handled at primary level is good. A lot of people are getting benefit. Having said that, see, medicine is a very tricky thing. You assess by outcome.
Mm.
But are you comparing apple to oranges? For instance, I'll give you an example. A person comes unconscious to anybody's emergency or falls at home. It may be a simple thing like low sugars. I just push some glucose, patient wakes up, right? What was affected? Brain was affected. He recovered with one shot of glucose. Now there is a person who has a small clot in the brain, we say subdural hematoma. This person we can put anything, we is using a ordinary twist drill. What you are using, same thing. I had made it in most of the place I used to go. I used to buy this 2,500 rupees worth hand drill, the drill bits, stainless steel only or tungsten carbide one. Sterilize it, put a hole in this, let out that fellow wakes up. That's also neurosurgery. The most complex person comes behaving, you know, crazy or not imbalanced. You find in the center of the brain a tumor which requires 12 hours and all kinds of gadgets for me to operate. And end of it, he may not fully recover if it is already damaged. So they will compare. Oh, that fellow was totally unconscious.
He woke up.
He woke up, a doctor did in 5 minutes some surgery, and this person took whole day and is not all right. So that kind of a bias patients are having, they are comparing. And unfortunately, the hospitals, the investing, they are looking at total number we did and outcome that came. So do you require that kind of a facility, that kind of a teamwork? Gone are the days when we were alone. It was desperate situation. We had to put all our effort to do that. That is the best thing that could happen. But today, you have the choice. But do the patient know, or do you go by advertisement? That is where I think if our conversation helps the needy people who are going to listen to us, we can give some information about how complex a situation is, then will more than that 1% makes a lot of difference. Because right, I will.
So you're absolutely right. So I feel that as doctors, we should be ever guilty about not spreading the right information or not spending enough time educating our patients, not as a community, but even your one single patient who comes in front of you. I don't think most of us are equipped enough
Yes.
to even know that that's a very important facet to do, because those small drops of
Yeah.
information spread into becoming an ocean of information for the community. Coming back to this, what are the common conditions that a neurosurgeon comes across? Because we hear, and the biggest myth that I think you will have to bust is, what is the difference between a neurosurgeon and a neurologist? I think most people don't understand this. So, if you can bust that myth and take it forward to speak to us about where does that fine line blurring end between a neurosurgeon and a neurologist, and then what are the common conditions, because we don't know if people know that if there's a spine issue whether they should go to a neurosurgeon or to an orthopedic surgeon. Whether there's a tumor, we hear about traumatic brain injuries, we hear about strokes, and a lot of people ask me that, my relative needs to go to a neurosurgeon. When I ask them why, they'll say no, he has some mental disorder. So if you can bust certain myths and talk to us about all of these aspects, I think that will be great.
Wonderful and most difficult question, I should say, from the to make it understand. But I'll try to make it simple. Let's keep the spine part of it for the second part of my
Sure.
answer or discussion. Now, as we know, the in general, in medicine, the like we have a cardiologist and cardiac surgeon, neurologist and neurosurgeon, gastroenterologist and gastroenterologist surgeons, and like that it goes a nephrologist and a urologist
Urologist.
or renal surgeon. So the difference is essentially we are supposed to know the gamut of diseases which can afflict brain and the nervous system, a
Right.
neurologist and a neurosurgeon. But there are many conditions, for instance, some types of epilepsy or seizure disorder, some types of Parkinsonism, some types of what I should say, vision loss, anything, needs to be infections, can be treated mainly by medicines. They are taken care of by the neurologist once it is diagnosed. That's something which cannot be treated by surgery.
Or is not indicated for a surgery.
Yeah, I'll come to that part of it. There are certain diseases like epilepsy or Parkinsonism. At one stage, or certain types of Parkinsonism in certain conditions, surgery will benefit, not just the medicine.
Including epilepsy.
Yes,
Oh.
epilepsy surgery, surgery for the Parkinsonism, and for you, it may surprise if I tell for certain kinds of dementia.
Hmm. Interesting.
So it's very confusing when I use that word to you also. Oh, Alzheimer, oh, there is a surgery. Oh, Dr. Krishna has found an answer to. No. Essentially, we are talking of a symptom
Got it.
or one particular result of a particular type of brain disease.
Hmm.
There is a condition called normal pressure hydrocephalus, wherein fluid collects in the brain. That is the CSF, what we call the
Cerebrospinal fluid.
fluid, which is already there in all of us, has to be in circulation. For
Right.
instance, in a day about 750 ml or so is produced, but at given point in time only about 250 ml is there in the entire system.
Hmm.
Let's not go into why it is there and all that. So for many reasons, it production is not matched by absorption. So
Hmm.
it slowly starts accumulating in the brain. They will present with memory loss. That is a hallmark of dementia, from
Okay.
Alzheimer's to many other types of dementia. In this particular dementia, that is the first thing it starts off, that forgetfulness. Many a times it may be elderly, so they are mistaken many often. They would have gone into psychiatrist or say this fellow is depressed, the old man and all that. Then they start developing difficulty in walking. So this is symptom analysis. So today we separate it out, and there are other condition called chronic subdural hematoma, wherein there is a chronically liquid blood collects after a small injury. It happens usually in the elderly, but can happen in anybody. They also can present you with memory loss. There are certain types of tumors in the brain,
Hmm.
right? They are present with memory loss.
Which could be benign or malignant.
It can be benign. 50% of brain tumors are benign, 50% of them are malignant.
Hmm.
So it is a symptom analysis. So there are certain signs. If you go to, it is expected that even a general physician should be able to do it. If not at first time, you should be referred to a neurologist or a neurosurgeon who will try to diagnose, rule out organic cause.
Hmm.
All the causes which I told, which are close to us, because that's what we keep treating, because it can be treated surgically.
Got
So
it.
they need investigation. So today, if somebody has a chest pain, doing an ECG is a must. It may be gastritis,
Correct.
but you have to rule out if there are certain conditions. So at one stage, or some stage, even if there are additional signs, we investigate and then decide whether it is something surgical or medical. So as a patient, you know, you are asked me second question, what are the common
So,
things?
so just to extend one more question into what you mentioned. So, would you recommend a patient, probably some of the people who are listening to us may benefit from this. They might have met a neurologist for, let's say, uh, dementia or Alzheimer's. Would you recommend them to visit a neurosurgeon as well? Because I learned it myself today that I did not know that neurosurgeons also look at dementia and Alzheimer's if there is a possibility to treat it surgically. Would you recommend they consulting a neurosurgeon as well? Or are all neurologists aware of this fact that, look, I would still like to take an opinion from a neurosurgeon? Does that happen by default as a protocol, or would you want the patient themselves to get initiated into making an appointment with a neurosurgeon and seeing them?
No, that's what exactly is coming to. It is not the question of to whom you go. Today it is investigated. A person comes with dementia will be investigated. That's what I was coming to.
Okay.
Who has to? At least a neurologist. If you don't have, at least a good physician.
No, but what I'm saying
What I
is,
mean to say is there are certain clinical criterias. Beyond that, you must prove it. We are lucky today. It was difficult to doing a simple CT
MRI.
scanning or an MRI scanning.
Hmm.
That is the gold standard. It has to be done either done by neurologist or a neurosurgeon. Once they do, then a neurologist will automatically refer to a
Okay, so it's a
neurosurgeon.
protocol. Okay.
If a neurosurgeon sees, he also rules out and then says, okay, it's a different kind of a dementia, it might be primary Alzheimer's, so my neurology colleague will take care. At some stage of Alzheimer's, a neuropsychiatrist will be involved
Hmm.
because they may present predominantly with psychotic symptoms.
Right.
So that's how there's always a teamwork. So that comes back to your original question, should isolatedly be seen? Ideally, I feel there should be departments when we are dealing with a major thing. Once diagnosed, yes, you can go back to the clinic.
Hmm.
Otherwise, you look at the inconvenience. If you have to travel in this traffic, what we see, I see today a neurologist and then he sends me to a scanning center, I do a scan, I come back after 1 week, son or daughter who is busy may not be able to attend to it. Yes,
Oh,
of
yeah.
course, today you do have video consultation, etc. But still there is nothing like person is at a shock first time somebody is diagnosing you as dementia or says if you require a tumor, because that gap the person can, if it is a clot, if it is a tumor, they still come late to us sometimes in middle of the night unconscious, because anything and everything finally what it does to the brain, it may be benign or cancerous, it doesn't matter. If it is going to kill the brain, it is going to kill the brain.
Hmm.
So it's not something seen outside, right? So diagnosis, diagnosis, diagnosis. We need a good clinical assessment and backed by today investigation.
In fact, I completely agree with you. In fact, I feel the biggest lacuna today in the entire way we're all practicing is, several times I think of this, it's like a game of football where the goalkeeper says, until the ball comes near the goal, I don't get activated. And I'm not watching what you guys are doing, I'm on my phone. And the midfielder and the backfielder and the striker says that until the ball comes to me, I'm not going to be active and I'm not going to be watching. That's the way, unfortunately, I feel medicine is turning out to be, because one of the key aspects is everything is connected. And I have been reading a lot of research, and I'm firmly looking at my own practice and patients, that a lot of people with poor dental hygiene and dental health affects the brain.
Yeah.
Right? So dementia and Alzheimer's today is being marked by the kind of oral hygiene status that the patient is having. I don't think we have ever had a conversation with a neurologist, a neuropsychiatrist, or a neurosurgeon on these things, and we don't exchange information. And we somehow get into this ego trip that this is my great profession and my degree, and I don't want to share information or gather more information, which ultimately is going to be beneficial for my patients. Number one. And second, I feel, is the ecosystem in which we are all working is so disconnected and is so much so focused on my personal growth and my personal uh, growth, not just as a professional but also financial standpoints, and so many things which come in, which are the necessary evils that have been brought down. And maybe we should talk more about these aspects going forward. From here, I think you wanted to express your thoughts on what are the common conditions that we uh, have, and I would also want you to extend your viewpoints on what are the simple tips that a common man should know about certain neurological conditions. How and what is it that they should watch for? And when should they reach out for help? And what is it that they can do in their homes, either to prevent, or when there is something that they see, how are they going to act?
Yeah. Um, See, let's take the as you know, like still in the minds of uh, even physicians, neurology is anything to do with brain and the nervous system is considered to be a complex, difficult thing to understand till we had the diagnostic tools, the CT and MRI. It has become relatively simpler, but we don't have the answer. They will not give us 100% answer. It
Correct.
rules out certain conditions, which is far better than the time we had 30 years ago, 40 years ago. Good things we can investigate in this city like nowhere else in the world. So cheap to get it. People think that getting an MRI scanning, CT scanning for 4,000 rupees is expensive. But I tell you, it's not even 10% of the cost outside this country.
And also get the diagnosis on the same day.
Correct. So there we are well connected, but that is not all. That is not all. There are patients. So am I going to a diagnostic center? If I have following symptoms, what we are going to discuss, when, where I should reach.
Mm.
That is most important to prevent further damage. Because we can talk of things like how do you prevent this disease, that disease. In terms of brain, we all know people say fresh air. It does really matter like that. Let's take it to the end. You know, the tips is how do I diagnose myself? How do I know when to go to whom? Should I go every day to a big neurological center or not? Having said that, I'll try to simplify certain of the symptoms. For instance, epilepsy or fits is one of the common symptoms a brain can throw. Why it happens? There's a brain is a whole. I mean, I know Shivats you are aware of. I'm telling for the audience.
Sure.
It's like a live computer, fully connected and always charged. So some short circuiting happens, it gets irritated, you get the spikes from certain area, suppresses or some other area. If it is a spike coming from an area which is controlling my right hand, then my right hand will start shaking automatically. That we call fits. Or if it becomes whole body starts shaking, then I may lose consciousness because it is like a sudden burst of voltage going up. That is one of the things. By that itself, have you made a diagnosis? No. We have to find out what is the cause for it.
Hmm.
Because that moment you treat it with some drugs, it doesn't stop there. We
Imaging.
have to find out what is the cause. Because as I told you, a simple, maldeveloped brain, a child which is born, which gets less oxygen to the brain,
Hypoxic.
hypoxia, an elderly person who is diabetic or is hungry, blood sugar goes down, he
Mm.
can develop. We are all sitting in this room, no ventilation, carbon dioxide level goes up, oxygen level comes down. I can throw a seizure or become unconscious. I have a kidney problem, kidney shuts down, the toxins in the body rise, I may become comatose or throw a seizure. I may have less salt, I will throw a seizure in my blood. I have more salt in certain condition, I can throw a seizure. So,
When you say salt, it's electrolytes or
simple sodium,
correct?
straightforward sodium, salt itself.
Oh, okay.
So, high fever, child can throw a seizure, right? So, what we know by seizure, there is something happening in the brain. So, a doctor will attend to, at that point in time, you are with a you're being treated for your particular condition like diabetes or anything, they will find out, but they will still have to investigate us. We don't stop at that. We control the seizure, but you will have to look at, is that the only cause or was there anything else triggering? Because same seizure can be caused by a brain tumor, can be caused by a stroke. Means stroke is nothing but a term used like suddenly if blood supply is shut off to a certain portion of the brain, it becomes dysfunctional.
Hmm.
It very easily we say paralytic stroke. Yes, if the area of the brain which is controlling certain parts of the body movement, then you call paralysis. But it can be a stroke in the area where vision is there. So if somebody suddenly starts not able to see one half like this, he starts hitting the wall on the side. These are the minor symptoms which appeared minor but actually has just caused a major thing, because commonly people identify unconsciousness or paralysis of the limbs or speech difficulty as something
Or fits.
or fits, but they do not know other parts of the brain. In
Hmm.
fact, about only exactly what we say motor strip is about less than 5% of the brain area
Hmm.
to cause us paralysis, remaining part of the brain has got various functions including
Other
what we are thinking, talking,
function.
understanding and doing this. So some of times it may be mental symptoms, a psychiatrist you are going, but today if suddenly something happens without much uh, psychological causes, it may be simple forgetfulness, as I told you, or it may be irritability, or somebody becoming dull, appearing depressed, or becoming hypersexual activity or hyposexual activity, um, then compulsions to drink a lot of water. All this can be a part of dysfunction of the certain parts of the brain, which may be again a tumor or a stroke.
Hmm.
These are the categories which used to get locked as a psychiatric patient for a long time.
Oh,
Longer the duration, it is unfortunate that we are dealing with a benign lesion, and when patient lands up it becomes so big,
that
as I
it
told
causes
you,
damage.
it has caused sufficient damage as to kill the brain.
Wow.
So at one stage, it is clinical person's doubt. I would rather even rule out, oh, it is not there, okay, fine, I will treat you. We should not be looking at it as a doctor simply ordered. But I warn here again, a person, we have sufficient number of, in a city like Bangalore or most of the places accessible, a neurologist or a neurosurgeon or a neuropsychiatrist who can assess these symptoms and then order. Because what after you order?
I'm amazed with what you're saying because with the sprouting up of so many quote unquote counselors who are not even doctors, who are thinking that certain things that you spoke about are just so common. Somebody having desire to keep on drinking water, and he may be or she may be thinking that I'm scared about something, I feel thirsty all the time or something like that, and is going and speaking to somebody who's not even a qualified doctor, who has probably got one some certification from some academy to be a counselor. Is that not putting a lot of burden on end stage disease or end stage problems where people are going unnoticed with some of these things? What has been your experience and what are your thoughts?
See, uh, if you see from my clinical outpatient point of view, we see all those problematic cases. Are they, if I take 100 people with psychological disturbance, how many of them can have an organic brain disease? The percentage may be small.
But
You
every
got it?
person's life is important to that.
Important. So that is where you cannot bring the, okay, it could happen. No. It has to be first diagnosed, ruled out an organic cause, and then treatment aspect counselors will take care of that.
So,
I decide. Even I get, sometimes family members, I think I'm depressed, I need a counseling. Arey Baba, you tell me what is happening. You know, they decide on themselves because that too much. Yes, but diagnosis is the most important thing in that.
so you come through a descending process and you don't ascend actually, because I think that's a very valid point for even our listeners, that if they feel that they have some of these symptoms, it's better to go to a thorough professional even before you get a diagnosis, rule out that you have no such organic issue. There's nothing sitting in your brain. Your brain is fine. Next is your mind. And that's what you need to go and fix and go meet anybody whom you like.
Correct. Absolutely. Why I took up on these symptoms first is because they are commonly missed. Today, as I told you, if you have a paralysis, you know that you have got a neurological disorder. Very, very rarely a true what appears like a paralysis can be functional due to
Right.
psychological disturbance, right? So, similarly, another common thing we miss is eye symptoms,
Hmm.
some vision blurring. We are all worried about, so we go to an ophthalmologist. A good ophthalmologist should be able to pick up whether there is the problem with the optic apparatus. What I mean by the eyeball, the lens, the refraction, the image formation, the retina, all that is what generally an ophthalmologist looks at. But the whole thing is interpreted through a nerve called an optic nerve, which takes the information into the its own as a cable. This is only what we see is a uh, lens of the camera,
Hmm.
the body of the camera. But if you have a digital camera, the processing unit is different. Or earlier times, the film had to be processed and then only you will get the print. So the bad photograph doesn't mean only the problem with the eye. So generally, a good ophthalmology center will be able to pick it up, the why this has happened. But it's if a patient at one point in time not satisfied, because there's the problem comes that double problems may be there, both with the problem of here as well as with the nerve which carries the image stimulus from the eye
Hmm.
into the brain. And we miss many often. They come very late, even today in our country. Blind. They come blind. To tell you, Dr. Shivath's last week, 3 children I have operated
Hmm.
with various problems of tumors in the brain around this optic nerve going back,
Wow.
elderly. That's one area. So again, in the neuro center, we used to have everybody. Fortunately, they have little doubt. They have a look at, if they think that the globe is normal, they immediately order a scan and then refer to a neurophysician. Headaches.
Hmm.
Moment people get headache, they'll go to the eye specialist because I couldn't see, I got headache.
Hmm.
So okay, you've gone to some specialist. Headache is extremely common symptom for many diseases, including 70% of them may be psychological, tension, headaches or vascular headaches. But again, clinical diagnosis.